All right, everybody. Hello. Welcome to the very cozy Fireside. Well, the fire is on the other side of the screen.
Just
but
believe us, it's a
believe us. It's a fireside chat. So we thought it'd be fun since all three of us are not normally together in the same place, but we were having a good time in Colorado skiing. So we thought we would jump on. Don't stop kicking the table.
Sorry, just trying to get comfortable.
This is, as you say, this is why we can't have nice things. This is true. So we thought we would jump on, and I did a post just an hour ago saying, hey, let us know any questions, and we're going to answer them. We could pull a little bit more Kent in there since Matt takes up so much of the screen. You hulking man.
It's got better balance now.
Yeah, that looks better. So as a reminder, in terms of if you haven't done any of these, if you haven't watched the first two videos, this is Kent Bowden. You can tell him who you are, but actually I don't need to tell him who you are.
Yeah.
I don't know.
Can I go now?
Yes, go ahead.
Okay. Yeah, welcome everybody. Hope you get something out of this. My name is Kent Bowden. I'm a osteopathic general surgeon, board certified in general surgery for the last 15 years, and one of the co-founders of OroRx with Matt and his wife. We kind of came about building this as a passion project because this is a void that exists in medicine, which is probably why most of you guys are tuning in right now. So That's who I am.
And this is Matt Sexton, the other founder of OroRx.
Founder number two. I am the clinic director, or you could say practice director of OroRx. So I'm going to be probably stage 2 after you get past the initial onboarding. You're going to talk to me or another NP or possibly a female practitioner if you prefer that.
By the way, Matt Jones is on.
Matt Jones.
Jonesy from Washington. What's up, Jonesy? So, all right, we're gonna jump into this. So you guys listed some questions out in the post, and if I see some more here, we'll try to answer them. But the biggest thing that's why we want to do this is because there is so much out there right now about hormone replacement therapy, GLPs, semaglutides, and peptides, and it's confusing the hell out of everybody. What Oro is more about is not necessarily providing products, but it's providing the service that leads to the products and understanding where your body is at, and then working with these guys to find how to make your body optimal. So it's not just saying, hey, here's a product, you should take this or you should try this, we think this is going to help you. It's actually legitimate medical diagnosis in terms of the blood work, and so that's what we want to really make sure everyone understands, because this is what I've been doing for a year and a half now, and I feel amazing for it. So I think I feel optimal. I feel optimal. Yeah. Like that's the best way to say it. Like my blood work, all my panels, the way I feel on a daily basis is honestly how I felt at 20 years old, and I don't understand, and it blows my mind because he feels the same way. He feels the same way. Both of your wives feel the same way. I don't understand why anybody else wouldn't want to feel this way as we're getting older, right? So once you hit that 40 mark, 50 mark, 60 mark, you're like, hey, let's just keep going through this. So let's start with this one. Matt, you can start this since you're the practice director. This is Shannon saying, where do you start? There's a lot of this information out there, but where do you start? Are there some hormones that are better? Well, we're not going to talk about the hormones yet, but just in terms of starting. So if someone's like, okay, how do I get started with OroRx or just even talking?
All right, Shannon, so that's super simple. You just go to ororx.com, click on the Get Started button, you fill out your information there, and you're going to get a lot of directions at that point. Basically, you're going to create an on-patient portal account, you do your medical history, you will sign your digital consent forms, you will get an email, it'll have some dates and times in it that are available for appointments, and we will call you at one of those after you've picked one. Very simple.
Yep. That's pretty easy on that one. So, and this is something that you guys also need to understand is the fact that you are not going to get a product from Oro, but you just can't go to the website and buy a product. This is not how this works. This is an actual medical telehealth company where they're going to do the due diligence. You have to get your blood work done, and this even includes peptides. Yeah. Like you have to, that's not we're not just throwing stuff at you.
So that on-patient portal account, that is HIPAA compliant. So
right.
I know everybody wants a fast track or, hey, I know Joel, so can I get a workaround? Unfortunately, no. I'm sorry, guys.
What? They don't get bumped up to the top.
No, I mean, you might get called sooner. That might happen. Joel gives somebody a nudge. But everybody still has to do the on-patient portal account. That's just part of, medical liability. We have to have that done.
Yeah.
You're not going to be able to go to an urgent care or to your family practice doctor just for a drop in and try and get anything that you want. Just like that, we're a legitimate practice. So we're going to treat you the same way because you are our patients. You're not our customers, you're patients. And so we're going to take care of you in the way that's safest for you.
Yeah. So, and then as some of you all know, as you've even gone through your regular doctor, your regular PCP, primary care physician, and have gotten pushback. So you understand that this is not something that's necessarily the easiest. But again, we'll dive into that a little bit more, as the medical world is not equipped, as Kent can attest to this because you're a doctor. Mm-hmm. The medical world is not equipped for this or trained for this, right? In terms of hormones, like you didn't learn about.
No, it has to be a passion project. Everybody reaches the same baseline level for training to become a physician, and then out of that you go into your specialty training from a residency standpoint. But even then, there are not residencies that are going to cover things like this. Even your gynecologist and obstetrician, though they deal with women's health issues for women specifically, and let's talk about then urologists for males, which they deal with males and females, but that's where a lot of guys are going to go for their hormone health or for their sex health. Those are things that they're not getting additional training unless they seek it out in order to address this facet of healthcare. So you need to find a practitioner who has that passion and who is interested in doing that, and that's where we fill that gap.
Absolutely. So, all right, so let's start talking about, because I think the biggest questions so far that have come through here are talking about hormone replacement therapy and testosterone. Obviously, for women, it's a much broader subject in terms of, guys, we're easy. Testosterone, here you go. That is not the case for women, obviously. So the first question Jennifer's asking, are the hormones synthetic or bioidentical? We talked about this in the truck on the way back.
Yes, we did.
Who wants to start?
I'll start. I'll do it in
Okay.
layman's terms, and then the doc can probably get more sciencey with it. So to break it down really easy, BHRT, bioidentical hormone replacement therapy. Everybody wants that because they think, I want something that comes from a person or a human, right? Here's the real deal, guys. It actually comes from a potato, specifically a yam, okay? So the yam is actually where they basically get the testosterone from. They kind of grow it, for lack of a better term, inside said yam. Then it's pulled out. They get that testosterone, and that's what you use. So if you want to think about it, you share DNA with a potato. So that's going to be your BHRT, right? And if it's synthetic, what they do is they make that BHRT, and then they pull from that to make a synthetic version, right? So that's real easy, kind of layman's way of thinking about it. I'm gonna let the doc take it over.
Bioidentical is become more of a marketing term, because it has to be bioidentical to get in your body.
Yeah, there are buzzwords that people like to use out there, but at the end of the day, if we're going to put you on a testosterone or a hormone replacement therapy, we are giving you the hormone as the replacement therapy. Right. It is not going to be a derivative that your body then has to alkylate or methylate or add an additional chemical bond to it in order to convert it into testosterone or even estrogen. When you get it, that is what you're getting. You are getting the actual testosterone or the estrogen. And
that's something that I think everyone needs to understand, is the fact that you were again, that second word in HRT is replacement. So it's because your body is not producing what it needs, so you are giving your body what it's not producing. And that's the biggest thing. So I think the word synthetic freaks people out.
And it's not that your body's not producing it. I mean, women have a normal testosterone range that ranges anywhere between 2 and 45 or 46, depending on the lab. So your body, as a woman, you naturally produce it.
We're producing at the high level.
Right, again, but what we're doing is we're up-regulating it. So that also leads into another question. Well, what if I can't do HRT?
Right.
Well, that is a question they need to ask specifically to us as practitioners. Why is it you can't? Is it because you have a history of breast cancer that is estrogen receptor positive? Well, then let's
Someone did say that.
Right.
Actually, she is. It was HR positive breast cancer, so she knows that HRT is not an option.
But that's estrogen. That's a totally different compound. So you're okay to reach out to us and ask those questions. We would treat it like any other medical consultation. But yeah, recognize that hormone positive breast cancer is not testosterone positive. It is estrogen receptor positive, which is a different type.
So definitely give us a call, because once we do your blood work and you may show low for testosterone, that may be the culprit.
Yeah,
So you
essentially
may just need,
still an ovary suppression and aromatase inhibitors. So yeah, call. You need to talk to these guys about that. So, and that's the big thing is, ladies, if you have specific things going on in your world, so as this person does, and there's a lot. I know Teresa also asked in terms of, so she's using testosterone cream. Blood levels are staying between around 20 to 40, and she asked her doctor to up it, and her doctor said no. So that's the thing is, if you are not happy with your doctor, if you are not happy with the answers you're getting, just like if you're not happy at a restaurant, you go to a different restaurant. If you're not happy with something, you go to somewhere else. Your doctor should be the exact same thing, even if it's insurance, right? You can get into PCP.
Well, so first of all, let's backtrack a little bit. Congratulations on your being a breast cancer survivor. Let's not gloss over that.
Yes,
so
absolutely.
That is awesome. In terms of that question there, yeah, I do not advocate for doctor shopping, but you also have to advocate for yourself. And if you are not getting heard, if you are not heard by your practitioner, then you need to go to a place where you are heard. And talking specifically about the estrogen creams, it's kind of shooting in the dark. You can go on a specific dosing, but that says nothing about what your body's ability to absorb is, because of the way that it has to be applied. It's not going directly into the muscle or going directly into your body. It has to get absorbed through a mucous membrane. So there is a lot of variability when you start applying medications externally. So you would likely do better if you went on an injectable form, because then it's actually a reproducible number that can be reproducibly tested, and you can see the actual effect from the treatment, as opposed to kind of just shooting in the dark.
And we talked about that on the drive home today. Is there's those levels of it, and I know there's people who are injection adverse, needles adverse, and I'm going to tell y'all, it's tiny. It's really not that big of a deal, but it's also when you start feeling better and you start feeling the changes, then you actually look forward to it. But that is the biggest thing, is you have those different, if you were like, say, no needles, great. You have options. There's the creams.
Did any gym rat actually love their first 30 minutes of cardio?
No.
But they saw the benefit. But they saw the benefit to it, and so they did it. And now they actually. Okay, so maybe that's not the best.
No one likes to do.
Right. But you may not like the idea of using a needle, but my mother-in-law has been a type 1 diabetic for 46 years, and she's doing fantastic. And she had to get over her fear of needles, and she's been doing needles multiple times a day, every day for 46 years, or she wouldn't be here. So people can change.
People can change. So let's just see another question. So as we're going through, we're talking about, so Francis asked, is there a real test to check hormones / cortisol levels that tell us what we need to help us lose weight during perimenopause?
A test to help you.
A real test to check hormones and cortisol levels.
So yes, there is real tests for those. Tests to tell you what you need to lose weight? No.
Yeah.
But basically your blood work tells us everything we need to know about you. And then we're also going to talk to you and get your story and try to figure out what you're doing. Do you have a good diet and exercise plan? Are you fasting? Are you actually putting in the work? Because that's going to be on you. Now, the blood work is going to tell us what to give to you. So that question is kind of a yes, but no.
Right. So in terms of, is there a test to check your hormone levels and cortisol levels? Yes.
Yes.
Now, when it comes to losing the weight, that's where the as we call it, I'm calling it, but we're trying, the trifecta of health, which is, where ORX comes in is obviously with your hormones, but you also still have to have your diet and your exercise figured out. So this is one point of that trifecta that will help you lose the weight, but it's not the only thing. There's no magic potion, there's no magic injection that's going to do it for you, unfortunately. But that is one piece of that trifecta. And then with that, speaking of HRT, Francis, St. Francis, thanks Francis, asking all these questions. So Francis is currently on, she says HRT, but she's on estradiol and progesterone, and she's gaining weight, right? So that goes into it. But what's the one thing that she left out, Doc?
Testosterone.
Boom.
Yep, you're not on testosterone, which is actually going to increase your metabolism and increase your lean muscle mass. And I would also question when they put you on that, because the majority of the physicians who put you on those haven't even tested your baseline levels. So if you are on HRT but haven't actually checked your baseline levels, you're shooting in the dark.
Right. So unfortunately, in perimenopause, a lot of doctors are just prescribing those two things just to replace what's missing, right? They're not.
Yeah, your body's naturally going to stop making more estrogen and progesterone as you age and as you go through menopause. That's the main change in life. And so a lot of times what they're doing is they're just going to end up supplementing that so that your body continues to feel or act as though you're not going into menopause, that your ovaries are still working, as opposed to saying, yeah, this is a natural part of what's happening. Let's ease you through that, and let's actually also increase your testosterone, which was also higher at a younger level, and get you to a level where now you're going to get to an optimal state, and you're going to have that lean muscle mass, so you're going to be able to burn calories better. You're going to be able to increase your bone or decrease your bone demineralization, because as those muscles insert into the bones, it creates bone strength, and it's going to counteract the natural process of osteoporosis that women really struggle with.
Yeah. And so with that, there was another question about in terms of getting, I'm trying to go bounce back and forth. You guys are asking so many questions, which we love. There was a question about in terms of getting your hormones checked about she's still breastfeeding or starting to wean her toddler. So is there a specific time that would be better to wait to get those levels checked?
Yeah, so in that situation, you're going to be pretty high on your prolactone as well as your progesterone, because during breastfeeding, you're actually going to have a higher progesterone level because your body will biochemically, it suppresses your ovulation during breastfeeding in a lot of situations. Not every situation, because women have, there is no standard. It's everybody's got different things that are going on. So in that situation, as you're in the process of weaning off, I would say probably you need to get to this. I would want you to be in the situation where you're completely weaned off the breastfeeding, and then we can go ahead and get you dialed in, because that's when you're going to get to a much more of a homeostatic or back to your normal cycle and your normal rhythm, which means that we're going to get a better idea of where your actual labs are when we draw them.
Yeah. So, and then Christina.
That was too sciencey, wasn't it?
That was pretty good though. That was
good though.
But it was also like that was like the shortest sciencey answer you've ever done. That was really good.
Yeah.
Doc can go down the rabbit hole and can talk for a while, but we'll jump in on it if he does. So, Christina asked, does the testosterone in women come from the ovaries? And if so, do you take patients that have had recently have had radical hysterectomy? A radical hysterectomy. How's it not radical?
A radical is if they don't take the ovaries out.
Gotcha.
So the easy answer to that is yes, we do.
Yes, we do.
There you go.
Yeah.
There you go, Christina. They do.
Yes,
So,
we do.
yeah.
That's the easiest.
The testosterone come from the ovaries.
The estrogen that's in your body actually gets converted if it's at a high level to be a low level of testosterone. So yeah, if you've had your ovaries removed, it's not going to affect us being able to go ahead and supplement you or take you on as a patient. It's actually not a problem at all.
Yeah. Actually, you would be a perfect person to talk
Yeah,
about
because
these two guys.
you've been put into surgical menopause at that age,
Yeah.
because you no longer produce any estrogen.
Yeah, now you've got zero. So
Yeah, so you gotta work on that. So a dude, we got a guy in here. Thanks, David, for jumping in.
Hey, there's guys.
We actually have a couple guys too, believe it or not. But so David says he's on testosterone. He's telling family and friends that it's raised concern of increased risk of prostate cancer. Doing blood testing every 6 months helps to monitor those levels, correct? Is there a greater risk being on TRT for prostate cancer?
There are actually some studies that are going on out there because TRT's been around for a long time, and no, there's not actually a linkage that they've seen in terms of, yes, that's the thought that's out there is, if my testosterone's really high, then my PSA is going to go high, and I'm going to run the higher risk of developing prostate cancer. Just because you're a guy, you already run the risk of having prostate cancer, so it's important already to go ahead and be checking your PSA at the age-appropriate levels, but that does not preclude anybody from being on testosterone replacement therapy.
Mm-hmm. Well, also, not only that, we do check your PSA on all your blood work for our guys, so we're going to monitor that the entire time.
Right.
And if you do get on TRT therapy with us, it's going to be microdosed, right? So you're not going to just get one
Just
huge,
gonna say
whopping,
that.
large
Yeah.
amount of testosterone. We're going to microdose it throughout the week, so it's going to mitigate any kind of side effects you might have, like maybe possibly exacerbating a prostate cancer, which again, is not going to happen the way we do it. And it's like the doc said, new studies coming out saying it's not a factor anyhow. But also, if you want to have even more fun with it, low dose 5 milligrams Cialis is shown to shrink the prostate. So
And it has other effects as well.
And it has other
By the
effects,
way,
so
the Cialis
there's that
does.
too.
But also, and I think that's for David, as you're watching, or if you're watching, and anybody on this, you guys, you have to understand that when it comes to, when you really start talking about, when we talk about testosterone and hormone replacement therapy, testosterone specifically when it comes to guys, it's like when creatine was the big thing, and people still have this notion about creatine. And like back in the late '90s, early 2000s, it was all about Mark McGuire, Sammy Sosa, because they were taking creatine, they were getting huge. You guys, it wasn't creatine monohydrate. It was all these other things that they were taking on top of that. And that's the same thing with testosterone. When people are like, "Oh, he's on testosterone, so he's huge." Okay, they are taking hundreds of units a week of testosterone. We are talking about microdosing, so for me personally, I am on 60 units a week, and that keeps me at 1,000 level, which is optimal, high end, nothing higher. That's it. It's a microdose. So it's not trying to get bigger or anything else. It's just bringing it back to what your levels were when you were younger. That's it. Yeah. We're not abusing this.
By stabilizing his levels, what Joel's talking about right now, gives him the opportunity to get in the gym, do the work, and eat right, and put that size back on. The drugs aren't going to do it by themselves.
Yeah. You don't get to take testosterone or a peptide or a GLP. I mean, some of the GLPs, yes, they will work.
Some of them are amazing.
Well, they work because you just don't eat.
Mm-hmm.
So we'll talk more about that in a minute. I just want to make sure we're getting all of the hormone stuff. Do you guys check cortisol levels in your tests?
Not normally, but we can add that in.
You check that. Someone asked in terms of
your cortisol levels are going to fluctuate all throughout the day, and so you can check them in an ICU patient when they're on a vent when you're trying to see what the stress level is if you're trying to extubate them. A lot of people are going to get hung up on your cortisol level, but it is going to fluctuate a great amount throughout the day. So you getting a snapshot is going to depend on everything that's happened on you in the last 12 to 16 hours, or even the last 4 hours. Like if you went into the lab and you just got in a near hit and run accident right before you got your labs drawn, we could draw your cortisol and it would be insanely high, and that's not really going to tell us anything. Yeah,
Christina said, speaking of the radical hysterectomy, she commented back and said, no blood work from doctors. They just said that she needed estradiol, so they gave her to her. Yeah.
Okay.
You need to call these guys. Okay.
Give us a call.
Yeah. You need to, Christina, you need to talk to them because there's a lot more to that could really help you. Let's see. Francis is 53, already have muscle loss, and my primary PCP told me not to take creatine because of my kidneys. Okay. Yeah, probably. That's where, so obviously if you have any underlying medical issues or existing medical issues, then that's when you want to talk to your doctor. Or if you want to come into here at Oro, you would do the exact same thing. You're going to get those exact same questions asked by these guys that your doctor would in terms of pre-existing medical conditions, so then they know what to give you. That's why you don't get anything from Oro before you get your blood work done.
Right. Also, testosterone is going to be metabolized by your liver anyways. So, your kidneys, yes, they are a concern, but as long as it's not something horrific and you're trying to mitigate that, you're drinking tons and tons of water and flushing it out, you still might be a candidate.
And she says she has no kidney issues. So,
I don't
Give us a call. Yeah, because I take it.
If you have no stage 1, stage 2, stage 3, or stage 4 kidney disease, then what you would see if a person went on creatine is they would have a elevated serum creatinine, which is a protein that your kidneys will end up filtering out. And so you'll have a number that's going to make it appear as though you have kidney disease. As long as you keep hydrated and are continuing, because one of the things I did want to hit on here is we are active, healthy guys who are now adding with this and encouraging you to add in the optimization that comes through the replacement of the medications and the replacement of hormones and dialing in medications that can aid in what you're already doing. And that's exactly the gap that we want to fill for you. We're not going to take somebody who's a couch potato and turn them into Cindy Crawford. Not without just...
That's what I was going for.
Yeah, you got to do the work. And so we are a We are the third leg of that stool to help you with that, but you also have to be doing the other things. And so if you're looking to counteract muscle loss, it's not that you have muscle loss necessarily. Yes, that's going on, but you are having loss of your muscle mass, and that's just because you're not holding as much fluid inside your muscles, which is really what creatine does. It holds the fluid in order to allow it to be more reactive and actually have a better contraction when you use it.
Right.
Sciencey.
But it's good stuff, because that's the thing is people also say with creatine, I don't want to get too far down the rabbit hole of creatine, which we could do another talk about. We probably could do a whole hour talk about creatine, because it is really good stuff. But there's also a lot of studies from Francis and a couple other people who, as you were getting up there in age, there's a lot of studies showing the benefits of creatine monohydrate for also just cognitive functions as well. So there's a lot of good stuff that creatine monohydrate can bring you.
It is fantastic.
It really is. It's 5 milligrams a day. And most people don't even do what's called a loading phase, where you would do 20 milligrams a day. It's unnecessary. So it would take a month to even get your body saturated enough to where you would start to see something. And in terms of seeing something, you really won't. Like, you really don't see a huge difference. It's just one little more thing that you're adding to it.
But to go back to our 53-year-old gal who's losing the muscle mass, don't stop lifting weights. You need to continue to lift weights. You need to continue to strain those muscles, and you will continue to you can continue to maintain, and you can even build.
Yeah, and last creatine thing, Mason said, can you take creatine up to a certain stage of kidney disease if you're flushing with tons of water?
We would need to check your labs.
I would really just defer to
definitely
your
run labs on that one.
PCP.
I want to know more of the medical history on that question. It's a great question.
Yeah.
Give me more history.
Yeah, that's call the doc on that one. Also for Mason, not a dumb question. There's no dumb questions in this, you guys. Is there a point where if you're taking TRT that your body quits making its own?
So your body's already quit making.
It's already stopped. So if you're at it, I'll let you jump on this, but let me say this. So when I got my levels checked a year and a half ago, my testosterone was a 400. That is, in medical world, normal, right? Normal range is what, 200 up to 1200. And the men's in males has a ridiculously large range. But it was 400, so it wasn't optimal. I wanted 1,000, between 1,000 and 1,200. So my body it wasn't making it. It wasn't making enough. So that's why I helped it, right? So
we did, yeah.
Now, but I know people are asking, am I on it forever? Because is my body, if I'm giving 60 units a week, does my body stop making testosterone now?
No, you're replacing it. So if you were making only 60 units a week, and you replaced it with whatever we gave you, obviously I don't know, you have to check your labs and stuff, but let's say we gave it to you. Now, what you are currently making will be suppressed, right? Because we're giving you what it needs. So it's going to stop making that until you stop taking testosterone. Now, it depends on how long you took that testosterone. Think of it as like, I took it for 3 months. It might take your body 3 months to turn back on those normal levels, but when that happens, you're probably going to go right back to 60. So, it's...
As long as you still have the organs that make it, you can still make it.
Yeah, you can still turn it back on. It just might take a while.
But your body will be, excuse me, your body will be seeing that there's testosterone in there, and so it's not going to be going through the processes to increase it or to drive it up.
Yeah.
As you wean off, if you choose to wean off in the future, your testicles will pick up in the gap and take over.
Yeah. Basically, if I stop taking, I'm going to go back to 400.
But I don't want to go back to 400. But you're going to go back to, at the highest, you're going to go back to the low level that you had at the beginning.
I don't want to do that.
And there is products to ease that transition if you wish to do that. So if you run testosterone for a long time and for some reason, I don't know why you would do this, you decide to come off it, because if you're feeling great, why would you want to stop feeling great? Unless it's a medical issue. If that is the case though, we can give you products to help that transition be easier. Basically help reinflate your boys downstairs so everything starts producing and turns on faster. Yeah.
There's lots of ways. I'm going to jump out of testosterone here. Robin asked, is age a factor for a prescription? I've been told I'm too old at 63.
No, not at all.
Never too old.
I have 63-year-old patients who act like 84-year-old patients, and I have 84-year-old patients who act like
63. Yeah, for sure.
The bottom line is, if you want to feel good and your hormones are the issue, give us a call.
Yeah. Rachel is an RN and asking if there's any job openings at Aura.
We are in the process of expanding.
A lot happening
It's
right
coming
now.
soon.
So Rachel, shoot me a DM. I'll forward it to the guys. But yeah, there's a lot happening. We've been skiing for 3 days, and we've also been doing a lot of talking and planning. So there's a lot coming. Let's see. So let me.
While he's reading through this, guys, before this ends, don't forget, we're going to make an announcement of what we're calling Oral Platinum, and I will tell you what that is at the end.
Teaser.
It's part of our new teaser. It's part of our new medical weight loss program.
Yeah, Julie is asking, and Julie, I'm going to ask the question, but there's a lot. We're going to have to be very summarized because we can go all day on this one.
All right.
What are all the benefits? What are the benefits of taking testosterone for males and females? What's the normal dosage? So dosage completely depends on the person.
Right.
But in terms, like, give some benefits real quick in terms of why you would want to do it, because we could go all day on that.
All right. So benefits for testosterone replacement therapy
For women.
For women, increased lean muscle mass, increased ability. Therefore, if you have increased lean muscle mass, you have an increased calorie burn. If you have an increased calorie burn, you have an ability to lose weight better. You have a better mood. You have a better libido. There you go. I can give you those basic ones.
There you go. And goes for men too.
Yes.
That's pretty much how it works. Your body, what I can say from experience on this is what I noticed was my workouts and my nutrition didn't change. I mean, you guys know what I do. This is my job. I've been in, as a body trainer, I've been in fitness for over 20 years. I wasn't changing any of that stuff. It wasn't eating worse, working out less. It was actually more so coming off of the lift more shoots. And but my body, I could tell wasn't right. It wasn't responding. And that's when I was talking to these two, because I was like, something's not right. And that's when I got my levels checked. And so I was like, okay, I already had 2 points of that triangle, that trifecta done. This was the top point. And then my body started to respond, and it went right back into, again, your body started to change. It started to show those changes. Whereas, as we get older, it's hard to see that. We all know that, right? You don't get away with as much as you used to. But that's the benefits. And yes, all those other things that he said, libido, that's always fun. Just everything. You feel better. You sleep better. Your cognitive ability is better every day. I mean, it just goes on and on.
It's not just testosterone, guys. You got to remember, my body needs estrogen just like a female does. She needs testosterone just like I do. Because both those hormones, also going back to what you just said, they control our libido, both of them. Mm-hmm. Their numbers for both male and female are going to be different numbers, but we still need them just the same. Yeah. So it's, I get that question a lot, and I see it and hear a lot too.
Mm-hmm.
Is it good for girls?
Yes. David said his libido's off the charts. He just needs to get his wife on her level. Yeah.
Well, and that's
testosterone days. You're going to be getting swatted at.
Well, but that's a really important thing. Excuse me. If you start watching reels and seeing things about this, I mean, we're not the only people that are doing this. We're doing it the best. So don't get me wrong.
Yeah, the best.
But if you are on it and you have a partner, you owe it to them to encourage them to get on it as well.
Yes.
Because you shouldn't be the only one benefiting.
Yes.
You need to bring your partner on board. You need to be lockstep together, because you can both share in those benefits. And if however we can help with that, get them signed up, get them into us. It doesn't help to have one person progressing and one person stagnating.
Yeah, that can cause a lot more problems than anything else, because you feel like you're going to move away from each other. So it is very, you definitely, and it's just like, just from a workout perspective, how many times I get messages saying, I started doing Lift 4, how do I get my husband to join? Or I really want to get so-and-so to join, my partner to join, which is great. That's what you want to do, because if you feel good and they feel better, and you guys are both feeling better, your relationship's going to be better. I mean, this is like couples therapy. It's like, if you feel like shit, your relationship's going to feel like shit. So
life is tough enough. Don't lone wolf it.
Yeah, don't do it by yourself. That's not fun. I
like to call it an optimized household.
Yeah.
Optimal. Yeah. Optimal. There's that word again, optimal.
Which,
optimal household.
By the way, for couples, that's our teaser for February, since we're already teasing about January.
Mm-hmm,
yeah.
Mm-hmm, mm-hmm. Does testosterone affect menstrual cycles?
Yeah, actually it does. Yeah, so in different ways too. So sometimes you might be having a very heavy menstrual cycle, or you might be having a very light one or a very sporadic one. It'll depend on what you and your blood work says, and when you see it and what stage of your menstrual cycle you're in, we'll be able to go from there. But yes, you definitely may need testosterone to help even that out.
Yeah.
Yeah. That's going to relate also to your age and to what your body's already naturally going through. Because again, with a woman, we are not giving you a virilizing dose. We're not dosing you in such a way that people are going to be looking at you walking down the street and be like, dang, she's on something. Nope, this is a micro dosing, so this is just to optimize you. We're not even going to get you to a high enough level where your body's going to start converting it back into estrogen, which does happen if you have a high enough dose. Then there's the aromatase, which actually converts it over into estrogen to drive your estrogen up higher. We're microdosing because that's where optimal is to get you back to a level that actually is at the top of what is considered normal range by labs.
Yep. Yeah, and that's exactly. Carrie asked, "What would hormone levels need to be for you to suggest someone to try HRT?" Well,
we need to know them.
Exactly. You got to know your levels first, and then just like anything, you got to know what the problem is. Oh, thumbs up. You got to know what the problem is before you can go after the fix. Right? If you don't know what the problem is, how are you going to fix it? So
we're going to run your labs. That's going to be one of the very first questions you get when we get you on the phone is, do you have labs for us? If you do, great, send them. If they're not what we need, we're going to take over and see if Quest Diagnostic have done for you. We highly encourage you guys to use us and our system because it's faster and already done for you. And we're going to take care of everything we're going to send you. You're going to go and do it. You're going to pay us. We're going to pay them. The whole process is very simplified.
Well, and actually, even if you do already have labs,
someone just asked that
yep,
question.
I'm going to probably draw a second set because it doesn't necessarily mean that they drew the right ones that we wanted.
Exactly.
And I want to trend you because as we continue to manage you, we need to follow you to see how you're responding to therapy.
Yeah.
So if you had labs that were 6 months old, then yeah, they're 6 months old.
And that's the thing too, y'all, is so there's two different sets of labs in this conversation. One is like the annual checkup, blood work that you do with your primary care physician,
check that.
And that's what I did a month ago. I do it every single year, and it checks your lipids and checks everything, right? And it's the normal stuff. That's not what we're talking about here, because it doesn't check your testosterone, it doesn't check anything else of those levels that you want. So this is usually because someone's asking if you have those labs, can you send them to these guys? Absolutely.
Yeah,
but
we'll take a look at them.
It has to, but I guarantee you, it's going to be missing there's going to be a lot of blanks.
It's got to have everything, and it has to be within 3 months.
Yeah.
Okay. Once you are a patient, though, we do have a mandatory 6 month, so twice a year labs. Yeah. And that can just be a checkup. You don't have to run the full thing, but we'll need to see the hormones on that. And for tweaks, so let's say you're on testosterone and you're not feeling like it's quite there, then we can do 3 months as well. So we can do 3 months and 6 months mandatory.
And that's the whole point of this, everybody, is the fact that you're doing something that's measurable.
Yeah, we're not just flinging stuff at the wall.
Right. So it's not a matter of like, hey, here's a pill, take this pill, maybe you'll feel better, maybe you'll lose some weight. This is actually doing things that are measurable changes, not just physically and mentally. You are gonna feel those changes physically and mentally, but it's also looking at your blood work, and that is how you know it works, because you can look at the blood work. It's measurable changes, and that's huge. That's a really, really big deal on that one.
Kicking the table.
Sorry. Last thing on testosterone, then we'll move on. So Christina is actually is excited. Looks like she's a client. Excited to start the program. She's said her stuff delivered today. Christina.
Oh yeah.
Yeah.
Hey, Christina.
So she said, when can I expect to start feeling better?
So normally in about 2-3 weeks.
Yeah.
I can't guarantee that, but that is usually when people start to feel the effects. You're not going to see the effects; you will feel them. So that's the whole point of therapy.
I
to
definitely
feel better.
I felt it within the first 2 weeks, for sure.
Now, will you eventually see, within a couple of months, see the effect and results? If you're putting in the work and, having a good diet, yes, definitely you will. But you'll feel them in the first 2 weeks.
Yeah. So Donna asked, well, there's a testosterone question. Donna asked, can you take testosterone if you're on high blood pressure medication?
Yes.
Yeah, like the doc said, yes.
We gotta check your labs.
Labs.
Gotta check the
so
labs.
Come back to labs.
Yeah, that's the whole talk to your doctor.
Yeah.
Talk to this guy. All right, so we're going to move on from testosterone. We're going to talk about, because there's some other questions in here, bouncing back and forth, where to go. And so let's talk about GLPs. All right, we know that's a hot topic right now. People, in terms of GLPs, someone has been paying attention and saw that the FDA ruling on tirzepatide. So is that going to affect compounding ability in the future?
It will. It's a large gray area. And let's just say they did away with it completely. Well, there's other options. The tirzepatide is not the only GLP on the market.
Yeah.
There's still liraglutide. There's still semaglutide. Retatrutide is in the process right now of testing, and that will get released soon as well. Retatrutide is going to be the new GLP-3. So you're going to have all the best of both worlds. So if they do decide to completely kick out tirzepatide, which I honestly don't see happening, because they keep changing everything, monthly and yearly, if you actually are following the FDA and all the reports they're putting out. So right now, I would say if you want it, and you specifically want that, I would say give us a call and get that while the getting's good. But again, it's a gray area. So
it's a gray area. It's going to be a moving target because compounding, that's part of what we end up doing is the pharmacies that we work with, we're not working with Rite Aid. Well, nobody's working with Rite Aid anymore. We're not working with Walgreens. We're working with pharmacists who actually are compounding and are licensed to compound medications in order to get them so they're specific for the patient's specific needs, which allows us to compound the tirzepatide or whatever other medication we're working with an additive in order to make it to the benefit of the patients.
Yeah, Tara's been taking retatrutide for 8 weeks, reached her goal weight, don't necessarily want to lose any more weight, but still has belly fat to lose. So she says, would you still suggest retatrutide or another peptide be better for targeting stubborn fat?
Oh, yes.
Yes.
Another peptide, actually.
Yeah, so...
I would stack my peptides.
Yeah, so there's a lot. And then speaking of that, Stephanie asked, what's the difference between a GLP and a peptide? I've seen people claim peptides are as effective at GLPs. True or false?
So, I mean, peptides, meat is made up of protein. Protein is made up of peptides. So peptides are everywhere. But again, it's a hot button. Everybody likes to talk about it. So a GLP-1 is a peptide. And that's just one of the peptides. There are many other peptides, and each peptide has a specific action or a specific interaction in the body that it's going to cause.
So there are, yes, so answer your question, Stephanie, there are peptides that are not GLPs that can help, can assist in weight loss. Mm-hmm. So, and then it just depends again, but there's so many of them and they can be so specific to the person. That's why you got to talk to people who know all of those products and can say, okay, based on your labs, based on what your goals are, and a timeline or whatever you have, these are the products that are recommended on that one. And for Tara, if she's been on retatrutide for 8 weeks, listen, you can't spot reduce, unfortunately. The science isn't there.
It's an overall process.
It's an overall process, and the belly fat is going to be the last thing to go.
Always.
And it always is. We all got it. We all got that little thing right here. Even Captain America over here has some of it. Believe it or not, it's small, but it's there. So it's just is there, y'all. That's the last thing to go.
Hopefully, you got those results with the retatrutide by diet, exercise, and medication. And so you've got to continue with that. So if you're done with that aspect, then you can probably work on coming off of that. But you don't come off of diet and exercise.
Right. Yeah, for sure. I think there was another question.
There was a question that I saw that somebody said, do we just treat locally? And no, we are licensed currently in 42 different states. So we are a telehealth. We do not have any brick and mortar store. You cannot come in and see us and schedule a face-to-face appointment with us. We are 100% telehealth so that we can treat as many people as we possibly can. So that's the answer to that question.
Oh, yeah, there it is. Mary was asking that. Yeah, so 42, good job. 42 states, and there you go. In terms of GLPs, I think that was it on the GLPs. GLPs, you're seeing them everywhere, right? You're seeing them on the commercials. You're seeing, like, everybody says, now we have GLP, or we have, what was it, Wegovy? Or Ozempic obviously is the big one, and you're seeing, Ozempic was made popular by Hollywood, so there's a lot out there, y'all, but it really, it comes down to just having that phone call and having that initial consultation and understanding what is out there and what your goals are. That's really, it's just like when I was personal training clients, same thing. I would sit them down, we would talk about what their goals are, and we figure out how to meet those goals. This is the exact same thing. And there's a lot out there. So do you guys treat in Minnesota?
Do we what?
Yeah.
Minnesota?
Yes.
Yes. Yep. Julie, Minnesota. Pennsylvania.
Yes.
Yep. There you go. Ta-da. So Ohio.
Yes.
There you go, guys. Three states already tackled today on that one. let me see. There was another one. So I think that was it on the GLPs. And look, there is a place for GLPs for people who are trying to reach a goal. I have never I've never been anti-GLP, but just wanted to understand it more and where it fits into this triangle of fitness and health. And that's the thing is you just have to understand that taking it doesn't do the work for you. It doesn't. And if it does, you're not doing it safely. That's the biggest thing to remember.
It cannot be a crutch.
Yeah.
If you use it as a crutch, you're just going to rebound. You're going to have a yo-yo effect. You're going to gain the weight back. So you have to have a good diet and exercise plan. That triangle trifecta Joel keeps talking about. If you've got that down and you use the medical weight loss, the GLPs and all that kind of great stuff, the peptides, yes, you'll keep the weight off. But if you use it as a crutch, you're going to rebound. The weight's going to come right back.
Yeah. Just the same thing. If you do lift more for 8 weeks and you were spot on your diet and you saw great results, cool. And then the minute you stop on week 9 and you stop working out and you start eating shit again, what do you think is going to happen? You gain all your weight back, right? So this is a lifestyle. Massachusetts.
Yes.
Yeah.
Montana.
Yes.
There we go. See, you guys, we're 5 for 5 on that one, so that's pretty good.
We're federally licensed, so my license is an unrestricted license across the entire country. The states can be a little bit hinky, but it also depends on the pharmacies we work with. Some of them are comfortable shipping wherever I'm licensed, which I'm licensed everywhere.
Yeah.
So there are some states that may be just a little bit more difficult for us to work with, but that doesn't change our ability to reach you.
Doesn't mean we can't get the license.
Yeah.
So if that state has a need, we can get the license. Also, guys, we do have California, and we have compounding pharmacies that will ship products to California.
That's a big deal.
It's a huge deal. I think we may be one of the only ones doing that.
Canada, or not, California's tough. Canada, not right now.
Yeah,
When Trump makes you the 51st state.
Oh, God.
I'm not.
What? I'm coming. No, we're staying away from that one. No. Hard left.
Hey, it's just because it's in the news.
Yeah, it's, I know, we've just been laughing about it. Let me see. Maine.
Yes.
Yep.
New England.
New England's not a state.
Yeah, I was like,
Hey, they wrote it. I know, but...
I mean, I remember my junior year of geography. It was not in there.
even I had to think.
I'm just reading what people wrote. Nicole, you're trying to catch these guys. Arizona.
Yes.
Okay, cool. Look at you guys remembering your.
If you live in the United States,
geography.
we can help you.
Yeah, there's ways to help everybody on that one. So, Nancy, the skiing the past 3 days have been amazing.
We put in 64 miles in the last 3 days.
That's what happens when you're fit. That's right. Nebraska.
Yes.
Yep. Cool. All right. Someone asked about glutathione.
Glutathione.
Glutathione is
probably the best product ever.
It really is. So
Next to oxytocin.
Someone is asking. I can't scroll up far enough where it was, but so I started glutathione troches, which are sublingual under the tongue or in your lip, and I do it daily. You can also do and that's not the most effective. Most effective is injection, but I'm good with it because my other stack is injectable. So doing the troches,
we have all forms of it.
And it's daily, and I'm gonna tell y'all, it's amazing in terms of just the way your body processes everything. You wake up every morning, you feel great. Coming out of the biggest thing was when I had my injections for my back. They put you out. You're under general anesthesia, and usually, if anyone has ever had general anesthesia, it takes like a day or two to come out of it. You're foggy. It was actually the last Whiskey Wednesday that we did in chat, and I was talking. I was like, man, I came out of that within like 2 hours, where my brain was just clear as day, like nothing happened. And Doc was like, oh yeah, you're taking glutathione.
Yeah,
Why?
There's no more
Why does it do that?
powerful antioxidant.
Well, so the liver's job is to filter. It's a constant filter, and actually, you can donate, you can lose half of your liver in your body, and your liver will regenerate. The glutathione is actually one of the main components that actually works with the filtration, and as your body ages, that capacity also decreases over time. So the glutathione is actually able to help in that manner, and so it's one of the main things that we can use for anti-aging and for overall metabolic health.
And he was Nebraska, by the way. Not New England. I said New England.
Well, then that's
That was Joe's fault.
Fine. Blame the moderator. It's fine.
I'm just thinking Patriots.
I think don't most men think of football or states in football? like football
Well,
in
yeah,
the States?
if they're, it was capital N, capital E. That's Nebraska.
It's been a long week, y'all.
Go Sports.
They're the Huskers.
Go Sports.
Go Sports.
What about people with DVTs, and can't take any HRT?
Still need labs.
Yeah.
Yeah, you got your labs, y'all.
Why are you getting DVTs? Yeah, that's the other thing.
Yeah,
So
so-
is it because you have
All this stuff.
We need questions with answers.
Yeah.
Great
So
questions
if you
to ask.
have, so really that's the overarching thing on this, y'all, is if you have any specific thing, I don't even know what DVTs are, but
deep vein thrombosis?
gotcha. Still don't know what that is.
Blood clots in your legs.
Thank you.
In the deep vein.
So you guys speak
Of the
Joel.
legs.
In the deep
I always tell these guys when they start going down that path of like the super sciencey stuff, I'm like, say it in Joel terms.
Yep.
So that way I can explain it to you guys. So let me see. Tracy's asking, I'm assuming you're asking about hormone, like HRT is effective with older women as well. Yeah.
Very effective.
Yeah, that's actually like the best time. That's when you really need it.
Yeah.
Is really how that works on that one. So last but not least, does Hashimoto's affect hormones?
Oh, you're talking about your thyroid and Hashimoto's?
Yeah,
It affects that one.
I mean,
Yeah.
your hormones are based on what's happening in your ovaries, your adrenal glands, your thyroid, and your pituitary gland. Those are the main endocrine organs that you have, and the thyroid ends up being a major regulator through which all of them kind of reach a homeostatic base or homeostatic point. So it doesn't mean because you have Hashimoto's that you're precluded from anything else. Again, we check labs.
Yeah.
Yeah. Always labs first. I'll give you a little sneaky tip on that one though. If you're getting results like that on your TSH, let's say your TSH is elevated, but your T3 and your T4 are not, because you got to look at everything as a whole. You might just need some selenium or some iodine. You may just be missing some trace minerals because your body's burning through them. That will skew those labs. Okay. Also, with your thyroid levels, you want to check that at least every 3 months. And if you're going to get a diagnosis like that, hopefully they've checked them every 3 months and they've been horrible the entire time. That would definitely dictate, yeah, you might have Hashimoto's for sure, and then you might need some kind of thyroid medication. But I wouldn't recommend you getting on thyroid medication until you have a definite check on something like that.
Yeah.
At least a year long.
Yeah, that's a big one. You don't want to just jump into it. Anna Lily? That's a pretty name. Do you talk about, do you do only hormone checkup? I just want to know if everything is okay and have a base for the future. She's in her mid-30s, so stuff starts going down from here. Don't be so pessimistic. But it's true. It's also kind of true.
What do you mean by only hormone check?
Well, I think like in just terms of full panel.
No, we do a full metabolic
Yeah,
panel.
yeah, full metabolic.
It's going to have lipids and CBCs and everything else you need on there as well.
Yeah.
It's not just going to be like progesterone, estrogen, testosterone. Your EGFR is going to be on there, your creatinine, your blood, your ALT, your AST, all that stuff's going to be on there.
Yeah.
And your precursor hormones too, which we haven't even talked about.
Yeah. Okay. We're creeping up on an hour already. Time flies. I think we tackled all the main stuff.
All right. So guys, while he's
All right.
doing that, look at questions.
So let's wrap it up. So let's talk about platinum.
So oral platinum. All right. I guarantee nobody else is going to offer this. So we have oral gold. Okay. If you guys know what oral gold is, I'll just go real quick. Oral gold is a GLP-1. Normally we use tirzepatide. That might change in the future. But I'm going to go with that for now. So you've got tirzepatide, then you've got tesofensine, and you've got 5-amino-1-MQ. That's going to be oral gold. Okay. That's going to be what I like to call the trifecta of fat loss. You're going to be attacking fats with 3 different mechanisms of action on 3 different fronts. So it's going to help you get rid of fat in 3 different ways. Now, platinum, we're going to add in tesamorelin, which is a type of growth hormone secretagogue. But the cool thing about this one is it actually gets rid of visceral fat. So things like maybe you have a fatty liver, which is really not good. This would be a great one for you. The other thing we're going to add in is AOD 9604. That actually stands for anti-obesity drug. And what they've done is they've taken a growth hormone and think of it as blocks. The first half is blue, the second half is pink, and the second half of the pink ones are 4 blocks. The lab is basically, they're creating this by chopping that tail end off and recreating it, over and over and over again. So now they have just that fat loss part of it, right? And so that's what AOD is.
Science.
So, yeah, a lot of science there. But you're going to get 5 products with oral platinum. So now we're going to attack the fat from 5 different fronts on this one.
Right.
So that's going to be something new coming this year.
Adding that in with your nutrition and your activity, you're going to have fantastic results.
Right. And that's the big thing is what you're trying to do here is, again, if you have a specific goal in mind and platinum is not something if you're coming to the table with this and you're saying, hey, I need to lose 10 pounds.
Right.
I mean,
No,
that's,
you could go way lesser.
Like, there's
Photo
a
signature.
There's a lot. You only need like one or two things. If you have a goal of like 10, 15 pounds, platinum is, if for someone who really needs some help.
And that's why also why we're going to counsel with you. We're going to take you in as a patient, and we're going to work with you to. We don't give every patient everything that they ask for, but we do work with them to give them everything that they need.
Yeah.
And then to go back to what Matt was saying about the visceral fat, like for guys, it's a really powerful thing because that's where guys store their fat. We've all seen the dads at the beach who have a six pack, but it's strapped over a pony keg. That's because they've got visceral fat that's in there, which is very, very hard to lose. And you can be a very active guy, but that's gonna be the last fat. And then go all the way back to the beginning where we're talking about the belly fat for the gals. Gals are gonna settle it in their hips and in this area right across right here. We've got the substances and we've got the medications to help you attack that, as well as if you balance it with your diet and with your activity. We're never going to come out here and say we're just going to give you the medications because that's only a piece.
Yeah.
Yeah.
And that's what I said at the very beginning of this deal is you're not going to get anything from Oral RX without your blood work, without talking to one of these two guys or Bree, your wife, who's also part of the onboarding process to make sure that like I don't get anything unless they get my most recent blood work. And yeah, you also don't get everything you ask for because they're going to look at it and say, no, that's not what you need. This is what you need. This is how we're going to do these things.
He doesn't get away with anything. We still watch him like a hawk too. So.
Like watch me more than anything.
Yeah, quite closely, yes.
And then speaking of, so with that, this a great question because people want to know, does health insurance cover the labs?
If you're going to do them on your own with your own doc, sure. But at Oral, we do not take insurance. We do take HSA and FSA, though.
Right.
Yeah.
For me to go through and try and get licensed with 50 different states and the 1,000 different insurances that are in each of the states, no, that's an insurmountable task. So you are more than welcome to take your receipts and submit them to your insurance. And as assertive as you are, you will get where you need to be.
Yeah.
If you're not assertive, then it's not going to work. But
And
your HSAs will definitely work.
HSAs will work, yeah.
Yeah, your insurance, depending on who it is, anyway, it doesn't matter. But they're only going to cover certain things. So by not taking insurance, we're able to hopefully prescribe you a whole slew of different things that you could never get before.
Yeah.
So.
And I think the price point is something to speak about real quick because I know there's a lot of questions about that. And usually the answer is like, well, how the question is how expensive is. The answer is it depends.
Yeah.
But
So-
from a
I can speak to that actually.
please.
So I work at a hospital, and I actually had all of my labs drawn through my hospital, which cost me over $800 to get the same profile that we do through the hospital. And we're charging our patients,
Females, what, labs?
yeah, for labs,
$214.
$214.
$214.
Males,
212.
yeah. I spent over $800 at my hospital just as a test run to see. So yeah, that was to try and I have, even as a surgeon, I have an insanely high deductible because that's just the way that healthcare is these days and age.
Alyssa said her HSA would not take the receipts.
Yeah.
It's gonna happen,
That does happen, unfortunately.
it's gonna happen. So
But
in
you
terms
can
of that,
still be persistent and you can take it to another level because
right?
health insurance is not in the business of paying for things, they're in the business of paying their CEOs.
Yes,
Sorry,
correct.
if you did not know that.
Doctor. That's a whole other thing. But so in terms of money, you guys, if you want to get those numbers in your brain, a little over $200, $215 max really for your labs. That'll get you in the door because that's what you need. And then honestly, testosterone is not expensive.
It's not.
It's really not. Out of all of the stuff out there to take, that's probably one of the cheaper ones.
Yeah.
It really is.
Really
Like
is.
I don't like. What do I mean, and I am not taking very much. But I'm taking obviously more than most females would. It's 60 units a week, but I don't know, $100 a month, maybe.
No, it's
Not even that.
So, guys, you're looking at about $199 a month, but that includes shipping, handling, taxes, fees. It includes the syringes and the
Yeah.
alcohol swabs.
Depends
And
on
that's
the
all going to get
doses, yeah.
shipped straight to your door. Yeah, again, it depends on doses, though. So, I would say you're looking at about $199 top end for your testosterone.
Yeah.
Females top end about $99 just because you're going to take so much less.
Yeah. So I mean, when you say less, it's like 10 units a week,
Yeah.
maybe.
That
Again,
also depends on your labs.
Yeah.
You know,
So
that'll vary.
this is in my opinion, a very affordable thing for people to be doing. And when I say that, it's like, okay, if you're thinking that initial cost of just a little over $200 for your labs, and then $200 a month, look at what you're spending right now monthly. Even if people are on a budget or something like that, there's everyone make sure they have like the newest phone and things like that. It's about what the value is, right? Is there value in feeling better?
What's your health? What's your health and your wellness worth to you?
Right.
So that's the question everybody has to answer.
Yeah.
What's your health and your wellness worth?
Yeah. So if you're going anywhere, and Kimberly just said, she goes, trust me, if you go elsewhere, it's so much more. Guaranteed on that one. So, all right, we're gonna wrap this up. You heard about platinum, oral platinum. That's the
new medical weight loss.
The new
I guarantee nobody has
that's
that.
They
might try to replicate it now that I said it.
How many products? It's
five products.
So you got the products on that one. You mentioned something in February. It's coming.
If you are on testosterone or hormone replacement therapy and you are in a relationship, do not be the only one. We're going to help you out in February with that.
For Valentine's Day, it's going to be
couples,
maybe couples. If you are also a current client, you should have gotten an email showing
check your emails.
Referral bonus, where basically you can get up to $75 off your next order. So if you're a current customer of ORX, that email went out. If it wasn't, reach out.
Check your spam.
Check your spam because it just went out yesterday. Right?
And I'm not reading the feed here, so I don't know how many of our current customers are out here. But this is just another way that we're going to continue to take care of you as patients. If you have seen benefit in your own life and you have have had a positive outcome from your experience with us, please be an ambassador for us. Share it with your friends, with your spouse, with your family, and we're going to reward you for that as well. Because this is a passion project. I'm a surgeon. That's what I do for a living. This is what I'm going to continue to do because this is where I can have, instead of just treating the people in my community and managing the local diseases there, this has given me a platform to reach across the entire country. So I can't just reach the 80,000 people in my service area. Now I can reach 300 million people. And you can help us to do that, and we can help you out as you help us.
Yeah, and that's...
Veterans and first responders, you guys get a discount. So make sure you let us know if you have a job like that.
Yeah, veteran, first responder. Mm-hmm. So you're going to get those. Obviously, you're going to get those discounts. But we love everybody in those two roles as well. I put in the chat oralrx.com. You go in there, submit the intake form, and you're going to get called fairly soon. But there's a lot of people, and there's current customers saying they're already feeling better. Patsy's feeling better already. Kimberly, current customers, they're thrilled. So again, we're going to keep doing these. We're going to keep putting them into the Joel Friedman Fitness Accountability Group because it's my page, and there's a lot of people here, and we just want to keep helping everybody on that one. But it's a good spot to have this, right? And it's a good parking lot. So this is recorded. We'll post about it later.
It's a great place to do it because people are here because they're already interested in improving their life.
Yeah.
Well, and lastly, lastly, before we go, guys, if you're a veteran, please call us. Ask us about oxytocin. It is life-changing for you guys. Trust me, I know.
Yeah. Christina says, would Joel Freeman be the referral? Yeah, sure. I'm the referral. if you say you heard about, you saw her talking and stuff like that, then that's a referral. There is no referral code or anything like that, but not yet. But
right, as you onboard and you talk with our staff, because it's going to ultimately lead to a conversation, and just let us know how you got there.
Yeah.
Or you already have our contacts, so reach out to us if you're an existing customer or an existing patient who is sending people along, because then we will know as they onboard and go through the whole process, we're gonna give you those credits.
Yeah. Yep. And to answer that question, that referral thing is patient mainly.
Yeah, that's the biggest thing.
If you can't say I know Joel, because anybody can watch and say I know Joel, so it really is to help. It's to more so help our current patients out.
Yeah, and then in terms of discounts and things like that, y'all, like I said, the email that went out is talking about those referral bonuses, and that's really if you've ever been in any sort of business world with customers, that is how a business can give discounts, is through referrals. So because you're bringing the business, so a business is going to reward their customers for bringing new customers.
And those of you that are having those experiences and those life changes because of this, somebody who's already been on a GLP-1 for 8 weeks and has already hit their goal weight, that's fantastic. Share that. and
because it works, right? That's why I talk about it. I talk about the things that's working, and I'll be talking more about those things. Like I've been trying everything as much as they'll let me to be able to talk about it, right? So I'm very soon will be talking about retatrutide because I've been trying a little bit of microdose because I wanted to see what it's like, right? So I can talk about it to you guys. But there's a lot of great things out there. Well, when we can. We can't yet. Retatrutide, but
very soon.
Finally, the last question is what's in the cup. Nothing exciting. We're water right now. We're hydrating, but
we're at 12,000 feet. We need to drink water.
Yeah, we put 60 miles in, but whiskey is next. All right. So thanks, guys, and we will see you next time. Okay. Bye.